Hello, my name is Dr. Farman Ali and I'm a GP family physician. Today I will be talking about ear infections. There are two types of ear infections. One is called otitis externa or external ear infection, and the other is called otitis media or middle ear infection. Otitis externa basically means that the infection is confined to the external part of the ear canal and it does not go beyond the eardrum. So how does this infection happen? Water gets into the ear and provides moisture for the bacteria to grow. This causes a further itching in the ear canal. People scratch or poke their ear, which causes a damage to the skin, and that becomes infected. This starts a vicious circle and the infection keeps growing. External ear infections are more common in swimmers because water gets into their ear canal on a regular basis. That is why sometimes it might be referred to it as swimmer's ear. Otitis externa is more common in hot, humid and sweaty weather because that is where the bacteria like to grow. Eczema and psoriasis can affect the ear canal and make the skin inflamed and flaky and put you at risk of external ear infections. Excessive earwax. If you have excessive earwax, the water gets trapped and the debris may also get trapped behind the wax. The bacteria are happy and they thrive in these conditions and cause infection. Ear syringing or use of cotton buds to clear the wax. If ear syringing is done by an inexperienced person, it may damage the ear canal or the lining of it. Remember, earwax is protective. So if it is too little, by constantly clearing the ears with cotton buds, that may expose you to external ear infections. Middle ear infections, which I will talk about later, can also predispose to external ear infection. The reason for that is middle ear infection may produce a persistent discharge which can become stuck in the ear canal and thus cause otitis externa. So what are the symptoms of external ear infection? Common symptoms include itching of the ears, a discharge from the ear, occasionally temporary dull hearing, pain is associated. Ears may feel blocked or full. Otitis externa or external ear infection can happen in both ears at the same time. However, usually one ear is affected. Sometimes the glands of the neck or the ones around the ear can become enlarged and sore. So there are three types of external ear infections. The first one is called acute otitis externa. This means that you have had the infection for less than 3 months, usually less than a week. Recurrent otitis externa, this means that the condition keeps coming back. You may feel that the infection is getting better and then you develop the signs and symptoms again. The third type is the chronic otitis externa, which means the condition has lasted or persisted for more than 3 months. Sometimes it can last for years. This is often because the underlying reason for the infection has not been dealt with or the infection is resistant to treatment. So what is the treatment for external ear infection? Most commonly, we use ear drops. The National Institute of Clinical Excellence recommends flumetazone combined with clivicanol ear drops. These ear drops are used 2 to 3 drops twice a day for 7 to 10 days in the affected ear. Other type of ear drops that we commonly use are Sofridex, which has got a steroid and an antibiotic, and they are used 2 to 3 drops 3 to 4 times a day. Occasionally you may require ciprofloxacin ear drops, which are used as 0.25 mils twice a day for 7 days. So how to apply the ear drops? You lie on the affected ears facing upwards. You put several drops in the ear and remain lying there for 1 to 2 minutes. Then press the cartilage in front of the ear canal a few times to push the drops as much deeper as you can. Occasionally, you might require or may be prescribed an atomized ear spray. Atomized ear spray, one dose delivers 60 mg of medication directly into the affected ear, and it is used 3 times a day for 7 to 10 days. Other treatments that are combined with the ear drops, they may include painkillers. Paracetamol or ibuprofen are most commonly used. In children, Calpol should be given according to the recommended doses. Occasionally, an earwig, which is a piece of gauze soaked in the treatment drops, is pushed gently into the ear canal and left there for 2 to 3 days. Remember, do not attempt to do this yourself. Seek advice from your clinician. Ear canal cleaning by gentle swabbing or suctioning or by careful syringing in experienced hand is also used at times to get rid of the infection. Sometimes you may require oral antibiotics. This is if the infection is particularly severe or the skin around the ear has become inflamed, called cellulitis. Then you may be given an antibiotics. The most common antibiotic used is flucloxacillin, and in penicillin allergic people, erythromycin is used. So how to prevent recurrent infections? First thing, let the ear discharge escape. Try not to leave any cotton balls in your ear. Do not clean the ear canal with cotton buds. As I mentioned earlier, you may cause damage to the ear canal or irritate the inflamed skin. Also, there is a chance that the wax may be pushed further into the ears. Keep your ears dry. Swimmers sometimes use silicone rubber ear plugs, which you can use in the shower as well if you are particularly prone to recurrent ear infections. Some people use a piece of cotton wool soaked in white paraffin or Vaseline in the outer ear canal. You can use prevention drops. Swimmers use acetic acid drops. If you have excess wax in your ears, use wax dissolving drops, which you can get over the counter from your pharmacist, or olive oil to dissolve the wax. Occasionally, if your current infection is not getting treated, you may require a swab being taken by the practice nurse and sent off to the laboratory to identify the organism, which may require specific treatment or antibiotic. If recurrent infections are not getting treated in primary care, they may be referred to the ear, nose and throat specialist. This is not routinely done. You may require an urgent admission to the hospital if the clinician suspects malignant otitis externa. The symptoms of that are pain and headache are more severe than the clinical signs would suggest. There is granulation tissue at the bone cartilage junction of the ear canal, or they find an exposed bone in your ear canal when they look into it. If there is any paralysis of the facial nerve, which will be shown by drooping of the face on the side of the lesion, or extensive cellulitis, considerable discharge or extensive swelling of the ear canal, and when microsuctioning or earwig insertion is required, you may be referred to the ear, nose and throat specialist. Keep your ears dry and do not use excessive clearing with cotton buds. Thank you very much.